there are three medicines or three names that have now become very, commonly used. There's ivermectin, there's remdesivir, and there is the use of plasma. Plasma now has been officially removed from the list of suggested treatments by the Indian Council of Medical Research. Doctors I've interviewed, even until recently, I've posed the same question. Are we fundamentally different as Indians? Are we different? Is the health ecosystem that we live in different? Therefore, should we be prescribed different medicines? So the answer seems to be that we are not. But yet the policy response, if I were to call that a policy response in terms of framing protocols, seems to be so far behind in time and space. And how do we even begin to address that?
So I don't think this is a policy matter. I mean, most physicians tend to have this maverick streak in them to kind of try and treat COVID in the manner they deem appropriate. Is that on account of the anxiety levels that are prevalent, patients are particularly anxious when they're not prescribed anything, when they're suffering from COVID. And this has to be addressed. This is not, the response to this shouldn't be your set of medicines that don't make any sense or a set of investigations, because that is going to put pressure and stress on the system. For instance, even inflammatory markers. I mean, there's no point in getting inflammatory markers done for cases of mild COVID every third day. We were at a point when laboratories in Delhi had run out of kits for, interleukin-6 and D-dimers and all of this. I mean, there's absolutely no indication for getting this done in cases of mild COVID. Similarly, I think when you've got all evidence that is against antivirals, particularly in the late phase of disease, it doesn't make sense for you to prescribe these antivirals. And then you've got patients, attendants, and relatives scampering around and scrounging for these medicines which get on the black market. So I don't think policy has anything to do with this, but you should definitely try and rationalize treatment. What is more important, in my sense, even telemedicine is a great could be a great source of succor for many households, because all that is required is a surveillance, a remote surveillance of the dwelling in which the patient is being confined as a part of home isolation, and figure out what would be a safe manner for primary caregivers to take care of the patient. Perhaps just a handful of tight-fitting N95 masks that are supplied to the family members would go a long way in addressing this issue and preventing transmission. I mean, there's wide-ranging consensus that 80% of cases of COVID are going to be mild, who will not require any treatment because this is a self-limiting viral illness.